Colics in children can be very, very, very distressing and discomforting for the baby. You see them early in life at about 4 weeks, 5 weeks, 6 weeks. Suddenly they just start crying, they clench their fist, they coil over, and they can be crying for hours, they can be crying for minutes. At the end of the day, sometimes it is when they are able to pull that they have some relief. It is not just distressing for the baby. It puts the father and the mother of this baby on their toes. I've seen women that are weeping because their babies are having colics. What is colics? That kind of waxing and relaxing abdominal pain that grips this baby, and the baby is crying all the cry she can cry in this world. It is not funny. What are the possible causes of babies coming down with colics? Digestive discomfort, a discomfort in the gastrointestinal tract, probably because of gas, a baby sucking, a baby breastfeeding, a baby, feeding from the feeding bottle, and he is taking in some air alongside the food that he or she is eating. This tends to interrupt or disrupt the immature digestive system that the baby is just trying to build on. Food sensitivities can be another challenge, can be another very high risk factor for a baby coming down with colics. And more often than not, it is not even about the food of the baby, but about the food of the mother. What the mother takes in is what is produced in breast milk, and it is what the baby feeds on. So there are certain foods that will increase the risk of a baby coming down with colics. Most mothers will run to the pharmacy store. They will be given some of those intestinal muscle relaxants like nospamin, like colipams. Pediatricians are against this because even though it happens rarely, it has landed babies in the operating room. It just shuts down the movement, the motility of the digestive system of the baby. You see the baby's stomach becoming swollen, vomiting follows, the baby becomes febrile to touch. It means the baby starts running temperature. The baby is not able to pass gas or even to poo at all. What should you do in cases like this, in cases where your baby is having colics, coiling up, clenching the fist, and crying unconsolably? Make sure that you feed your baby slowly and don't feed baby too much per time. That is one. Once you feed your baby, allow baby to be upright for some 20-30 minutes. Rub and pat your baby's back gently until your baby bops. It is very important. When you feed your baby, especially if baby is breastfeeding, for example, let the lips of your baby latch very well on the areola. This will reduce the risk of your baby also taking in air while baby is breastfeeding. This will help to reduce the risk of colics in babies. Now, when should you become very, very scared? If baby is having symptoms of colics, that is the clenching of the fist, coiling over, crying unconsolably, crying for long periods of time, in line with the baby running temperature, that's the baby having fever, the baby vomiting, having abdominal distension, or even having diarrhea or complete constipation, then you will need to see the pediatrician. Outside this, you do not need to start running after buying any of those drugs that I mentioned to give your baby. Like I said, it has landed babies in the operating room because the motility, the movement of the intestines just shuts down, such that it is constipation that follows, such that it is abdominal distension that follows, such that it is vomiting that follows, such that your baby becomes irritable, such that your baby cannot even feed again. The other thing is this. I mentioned food sensitivities from the mother. There are things that you will need to stop eating or reduce eating once you notice that your baby is coming down with repeated colics. Beans and beans products. Beans, my akara, and all of those stuffs, you will need to stop them. Milk, as a mother, milk. So if you have to take tea, If you have to take pap, if you have to take custard, when your baby starts coming down with colics, please stop beans and every product that is derived from beans as food. You will need to stop or reduce milk in your diet. They start having colics at about 4, 5, 6 weeks. We expect colics in children, in babies, to resolve once they get to 3 months, 4 months, 5 months, thereabout. But I mentioned the warning signs for which you will need to take the baby to the hospital: fever, vomiting, abdominal distension, and diarrhea. We want you to nurse your baby into a healthy child. We don't want you to stress yourself while nursing your baby. So please look at the warning signs, look at the things that you should do to prevent or to reduce the frequency, the duration of colics. Most children will have it. About 60% of children will have it. You will see families telling you that, no, my baby had colic, my baby had colic, my baby had colics. Most families will complain about it. But at the end of the day, we want you to raise a healthy child. Cheers to every parent. Cheers to every mother who experiences sleepless nights, stressful afternoons. Cheers to every baby that is born into this life. I will see you in the next video.